Welcome back to House Education on February 15th. We're now going to get essentially an update from the field on Act 67 of 2021, I think. And sort of how it's going with that about community schools. I'm really going to turn it over to Representative Brady to discuss a little bit of the history of the bill. And then we'll get some testimony from the field, beginning with Jason. But first, Representative Brady, if you could give us a little background, a little history.
This was a bill that came out of our committee 2 years ago, led by Representative James Manchester and our former chair, Representative Webb. It was something that they really got interested in after, I believe, an Education Commission of the States conference. So the group we heard from this morning, that's a really helpful kind of research entity comparing states. It was either that or NCSL, one of the two. But they went to a conference years ago and got really interested in this model of community schools, the idea that our schools are more than just education from 8 to 4 and reading, writing, and arithmetic. And heard some pretty compelling stories from work that was happening around the country to create more community-focused schools. So we ended up creating a grant program, which we might talk today about the challenges perhaps of grant programs versus other types of funding, but for up to $10 million in a competitive grant program that schools, that districts and schools, I have to double check if it's districts and schools or just districts could apply for. Run through the Agency of Education. There were some parameters put in there to try to create a little bit of targeting. And so we are really excited today to hear how some of that money has been spent, what the schools have been able to do with it, perhaps what some of the challenges have been. And I think it's a model and a way of moving forward and thinking about schools that many of us are interested in, realizing that schools do a lot these days.
Our apologies, Jason. We've been muted the whole time.
But you nodded like I was really, it sounded like I was really summarizing it well.
So we just had a background of what Act 67 was.
Yeah.
And we're just excited to hear how it's going in the field. And we'll turn it over to you first to sort of talk about how you have used the grant and sort of what your vision of a community school is. And I just want to, for the committee, when we talk about community schools in this context, think of it as a capital C, capital S. It's a proper noun for a program as opposed to a community school, little c, little s. Yeah. So Jason, if you could introduce yourself and tell us where Hazen is and who you serve, and then about the program.
Hi, I'm Jason DiGiulio. I'm principal of Hazen Union High School in Hardwick, Vermont. Well, Hazen Union School. It's called Hazen Union High School number 26, right? That's our school district. We're part of Orleans Southwest Supervisory Union, and I serve 7 through 12 students in the gateway to the Northeast Kingdom. Now, Hazen is a really interesting school in that it's part of a supervisory union, and there's a companion district that serves all the elementary students. And then there's 2 members of the elementary district that don't have an identified high school. So there's really and then Craftsbury is a district right next to us, part of the same supervisory union, has their own K through 12 system. So Hazen exists, what I would consider in the center of that ecosystem of various districts organized under a supervisory union. We have about 301 students, serves 7 through 12. A significant portion of our population is really high needs in terms of reading, math, social and emotional learning, physical health. There's a lot of trauma in our communities, especially with drugs and violence and alcoholism. And so students come to Hazen with some pretty significant needs, right? And that's reflected in our free and reduced lunch numbers. And Hazen also has been dealing with the fact that we have a declining student population, and it was projected that we would go from about 300 students in the last few years to maybe like 260 students in a couple of years to come. Although, as I'll talk in a minute, community schools may be helping to address some of that as we talk today. So we are noticing that Hardwick exists as a community in between various service areas. It's one of those places that's served in various ways by different organizations located in towns around us. But in many ways, nobody's responsible for anything. So a good example of that is mental health services. So if somebody is before the age of 18 or 17 and younger, they're served by the Northeast Kingdom. But if they're 18 and above, they're served by Morrisville, which means that we always struggle to figure out who to call for something, especially for those people right in the cusp of things. And that happens with food shelves. It happens with heating assistance. It happens with the Department of Labor, like which office do we work with? And so about 20 years ago, there was a PATCH program, and PATCH was an acronym that stood for something which I can't tell you now, that helped address some of that overlap. And in the overlap, there was nothing for many of these things. And so for many people in Hardwick and the surrounding communities, they need to drive to Morrisville, St. Johnsbury, or Newport to get the services they need. And as you know, from some of your constituencies, I'm sure you know, that the actual owning a car, getting it road legal, having a license, and accessing the roads to get services is a point of privilege that many people still struggle with. And transportation in the Northeast Kingdom is definitely difficult. So in that complex milieu, the school exists as this wonderful building with a lot of resources, open from 7 in the morning until 4 at night, and then closed on the weekends. And that's just the way it is. So when we saw the struggles our students are going through and the needs of the community, we applied for a community schools grant to see if we could expand our work-based learning program, make learning a little more relevant to folks so that they might see that there's a viable living to be had and they could have choice in their life once they graduate, maybe make a life in the community in which they've learned, and that could be viable. And also coordinate some resources, because if the students in their community is thriving, then the students would do better in school. And if there was more resources at school, maybe the community could thrive too. And so we've been working out some pretty careful partnerships to try and knit this network of services and needs together, rather than replicating work across different contexts, depending on which agency we worked for. So that's in general sort of where Hazen has been. And like I said before, we had a declining student population projected for last year and the years to come, but it looks like the flexibility that we've earned in the last couple of years, largely through community schools, may have stemmed some of that tide. So, Mr. Chair, is that a reasonable summary so far, an introduction, or work?
That's great, yeah, and maybe a little bit more about, how much did you apply for and how are you using the funds?
Sure. So our grant, I think, is probably on the smaller side, but please don't let that mask the impact. I think we applied for about $150,000 a year, which for a small school like Hazen, we have about a $6.5 million budget. So this looks like it could be pretty small. But what it's allowed us to do is expand our capacity, especially mine. So I have most of that money is going into a community schools coordinator. So one adult in the building that has flexible time, who's entirely focused on making the bridge between the community and school and all the different projects and ways that it happens. And I thought her name is Miss Smith, Danny Smith, and she has been instrumental in helping me get much of this work done and helping Hazen take its steps. So when we were designing that, so we got that money, that's largely what it goes for, but there's other projects within that. A huge one was telehealth equipment that is inside our school. And this year, we've just worked out the agreements with a local medical facility to use the insurances and the structure that they have so that our doctorate level nurse, our nurse practitioner in our health programming can actually perform telehealth services for our students rather than sending them to Morrisville to be evaluated for things. We can do that inside, take care of much of it, save the parents a ton of time, and keep the kids in school. And if that goes well, then the goal next year is to branch that out into some of the community as well, so that they might not have to travel, they can come. So that's another huge project. Other aspects of the money beyond the coordinator is really an expansion of our flexible learning program, using Danny, our community school coordinator, as part of the help, and also building and expanding our community partnerships. We have about 97 community partners that meet bi-weekly in a community partners coalition. And so the community school coordinator helps run that and keep track of everybody. So we have some pretty concrete SMART goals that I can go through, but those are the big ones. The telehealth, bringing resources into the schools so that students thrive and the community can thrive. The community school coordinator, expanding the access to flexible learning, mentorship, and multiple tiered systems of support and community partners.
Representative Brady has a question.
Could you
Sure.
give just a little bit more detail about some of that work-based learning and a specific example or scenario, something that has you've been able to do?
Sure. So when we were designing the community school coordinator job position, right, it was difficult to find just the right person. We weren't sure if they were going to be a licensed person or not. And as you probably know, to work in a school and to have credit-bearing activities, one must hold a credential, right? And that's through the State Board of Education. So we have our community school coordinator is a work-based learning coordinator, and she holds that credential. So before her, we had one work-based learning coordinator and one flexible learning sort of specialist that was also a work-based learning coordinator that helped us. So previous to this year, we had 30 to 50 students experiencing flexibility, especially community-based flexibility in terms of like apprenticeships, pre-apprenticeships, job shadows, that sort of thing outside the building. And this year we have almost doubled that, having just one more person on in the capacity to, because it used to be that the work-based learning coordinator, her name was Jen, used to try and corral and recruit community partners, used to try and run meetings, keep notes, like all these things that we're all trying to take on as additional tasks. We now have one person that really does it, and it helps take the somebody specifically focused on there. So we have a blacksmith student. You know, if you wanted a really specific example, we have a student that has a real passion for blacksmithing, and it's not much in the local area, but there's some proud history of it. And he has organized a lot of his academic experiences around sort of and through the lens of blacksmithing and volcanology and that sort of thing. And so I'd love for you to be able to come and visit some of his work. I believe his website is Alderheart Forge or alderheart.com, something like that. Anyway.
Great. We have somewhat limited time, so we'd love to hear more from the field. So Elaine Collins, why don't you join us up front? And if you guys want to come up together. And just introduce yourselves and tell us where your schools are, who you serve, and I'd love to hear what you have to say.
Certainly. I'm Elaine Collins. I'm the superintendent of North Country Supervisory Union. This is my first year in this particular job, but my 12th year as an administrator and my 33rd working in Vermont schools. North Country, with me today is Sam Stevens. She's our community schools coordinator for North Country. North Country Supervisory Union spans about 400 square miles and 65 miles from one end to another. I'm new enough in the job that I have to read from the list, so I'll read from the list. We have Brighton Elementary School, Charleston Elementary School, Coventry Village School, Derby Elementary School, J. Westfield Elementary School, Lowell Graded School, Newport City Elementary, Newport Town School, North Country Career Center, North Country Union High School, North Country Union Junior High School, and Troy School. About 2,600 students in 12 different sites and about 400 square miles. It's a large supervisory union. We are not a unified district, which means that each school still has its own governance structure and that they rely on the supervisory union for things like resources. At our supervisory union, we applied as an SU rather than an individual site because our supervisory union is what we view a force magnifier. We help to provide at the supervisory union services and resources that individual schools, particularly small schools, wouldn't have an opportunity to do, like behavior specialists or neurodevelopmental specialists or early childhood coordinators, a community schools coordinator and her team. We do have at individual schools things like homeschool coordinators and guidance counselors and those sorts of things that are boots on the ground, but our force magnifier is Sam and her team, as well as some of the other things that we provide. I want to give you just a little bit of context about our SU. Like Hazen, we have a fairly high poverty index. We have a lot of students who come to us with need. We have schools that have as much as 80% free and reduced hot lunch population and some that are much lower, on average of about 56% across the entire supervisory union for free and reduced hot lunch. I know that you've heard testimony before, and all of you are very well aware that our schools are doing more, as you were referencing before, than ever before, because we have area agencies or designated agencies, DCF, other agencies that provide support for families aren't able to do that to the level that they once did. So when we bring students to Northeast Kingdom Human Services, and no fault of Northeast Kingdom Human Services or anyone else in our service provider area, they don't have the ability to provide services. We often have kids who are in crisis, who require immediate assistance, and they're told they have a year's wait. They're on a waiting list. Their case is not emergent enough. That's true also of housing and food insecurity. So those kinds of things, like when you have students that are living in tents and campers, and it's 50 below zero, and we still have families living in campers, and there's no other housing options. The resource that comes to aid are schools. Our kids show up every day, and we don't have the ability to say to those families or to those students, I'm sorry, we don't have the resources to help you. We figure out ways in which to do that. It makes us a little bit of a quasi-social service agency. And the work of community schools aligns very much with that. And so rather than fighting against that, community schools helps us to embrace that idea and hopefully bring resources along with that. So as you are evaluating the work and seeing whether this is replicated, can be replicated across sites and can be continued in the sites that have already piloted it, I think there's a lot of hope in the work, and that our philosophy has been really to embrace the work rather than to rage against it and say it's not our responsibility. So we have about 50% of our students that qualify, as I said, for free and reduced hot lunch. We have about 26% qualify for special ed 504 accommodations, which is high compared to the state average. But that's a reflection, I think, more of our demographics and some of the things that our kids contend with: substance abuse, domestic violence. And if you look at a student who might come to us who is sitting next to an age mate peer who has, had breakfast and a supportive family environment, and many of our students come to us through no fault of our own, or actually no fault of their families. They may just have the clothes on their back. They don't have any food in the house. They may be having some housing insecurities. Someone in the home may be dealing with substance abuse or with mental health issues, and not being able to receive the help that they need for that. And you look at those two students who are sitting side by side in the classroom together. Those two students have a very different experience and require, the second student's going to require many more supports in order to be able to access his or her education as compared to her age mate peer. So that's the work of community schools. That's the work that Sam and her team are doing, and she'll talk more about specific work that she's doing.
Thank you, Elaine.
Yeah.
Does anyone have questions for Elaine before I?
How much did you apply for?
228,000 or
In the first year.
58,000 in the first year. Yeah.
Great. So as Elaine mentioned, we work with a team model at North Country Supervisory Union in our community schools office that is unique within other community schools, I believe. I have 2 outreach team members who work with me, and I really operate as the lead of that work. My team is highly skilled in the area of social services, but also in collaboration and partnership building. We were lucky to already be well positioned within the community. We were at the table at most of our community partners, organizations, and meetings prior to the start of the Community Schools Grant. So a lot of the increase in collaboration has been with new partnerships that provide direct programming to families and students. We are also funded by ESSER and by a Bernie earmark that has really increased our capacity. So the funds are used to pay for the community schools coordinator salary, and then we have ESSER funds that are providing funding for the 2 outreach staff. We felt like that was a really essential post-COVID investment to make to help schools and families get back on track as we come out of the pandemic. We also were very lucky to be able to apply for a Bernie earmark 2 years ago. And so along with some McKinney-Vento sub-grant funds, we have a classroom and a kitchen and 3 vans that make our work very highly mobile. mobile. So we think of it as a hub that has the capacity to move to any corner of the Northeast Kingdom district that we serve. And I can't tell you what a huge benefit that is. Jason mentioned the challenges around transportation, being able to go to a family who has called us in the morning and said, so-and-so has missed the bus. We still really want them to go to school. And for us to be able to show up doesn't just mean that a student is in their classroom that day, but also means that the family is building trust with us because they know that if they can call for school, they might call for other things that they need. Elaine did not undercut the need for providing basic needs support to families and students in our supervisory union. I came to the district as a part-time 12-hour-a-week McKinney-Vento coordinator 5 years ago. At that time, we were identifying approximately 13 students a year as qualifying for McKinney-Vento homeless services. By the end of the first year, I was a full-time staff member because we were identifying 111 students as recently as last year. So the population has increased, but also our identification had increased. At the same time, in that 5-year period, we went from serving 5 English language learners to this year 23. And so we're also doing a lot of work with students across the board who have experienced educational transitions. And because we had McKinney-Vento subgrant funds, we knew what the power of having those resources could do to increase student access to learning. And we wanted, through the community schools grant, to be able to expand those resources to any student who needed those supports, regardless of their housing status. So it has been a primary pillar for us, the integrated student supports, to be able to expand that access. Also within that, we were able to pilot a program called the One Grocery Delivery Program that began during COVID, purely to serve the McKinney-Vento eligible population. We partner with Rural Community Transportation, who supplies a volunteer driver, so we reimburse for mileage, and we work with the local Capstone Agency food shelf. Every week we serve 101 individuals in about 40 households. 60 of those back and forth, up and down, are students. We know that those are essential nutritional supports. We initially did that because families didn't have transportation to the grocery store, but we expanded our definition of barriers to include anything that prevented a child from having adequate nutrition at home. So if a parent was isolated because they had mental health concerns that prevented them from leaving the house regularly, we wanted to make sure that the program could serve them. I have been thrilled with the collaboration in that program. It is, I believe, highly replicable, and it's one of those things from community schools that I hope we could look at for some other rural communities in Vermont. We didn't just focus on integrated student supports. We already had a very robust, expanded and enriched program through our Encore after school and summer program, but we were able to add material resources that increased support for programs that were offered in our 12 schools, or rather 11 through those programs. And we were also able to do more partnering with that program. So for example, we have launched a community stewardship day, 3 days a year, 3 Saturdays, where we partner with the Encore staff to provide community-focused opportunities to think about service learning. There's one coming up in March that's focused on preparing for Green Up Day. We're calling that a Green Up Party. Murals on, trash cans, decorating high visibility clothing, getting information out to every school community about how they can participate in Green Up Day within their town clerks, planning and programming. And that's allowed us to also collaborate with some other programs. So for example, the Nulhegan Abenakis will be coming in to do some tick education at that time in collaboration with the Vermont Department of Health. So there are some ways that we've been able to nestle programming, even though we didn't have a huge need to expand to serve expanded and enriched pillar in that way. Another major focus of our work has been in the area of truancy. Elaine cites it in her written testimony that we have a significant concern around absenteeism in the district. That is not purely because of COVID. That was something we'd already struggled with. So we launched a program called the Restorative Truancy Model that partners the restorative approaches that are available through our Community Restorative Justice Program with really student and family-centered meetings one-on-one to help understand what are the issues that are coming up for families, because every single student's reason for not being present in the classroom is different. And so having the right people in the right jobs is huge. But I also know that this is something that with mindset change, behavior change, for truancy officers, truancy task forces, administrators, and others, we can really, I believe, make a dent in what has become a significant issue post-COVID. That's another program that I would like to see expand. And so we've been able to talk to UVM through the partnership that the AOE has created for us, for them to look at our attendance data, interview folks who have been involved in that process to understand what are the key components and how could that possibly be replicable. You had asked Jason about some of the other specific partnerships that they have increased over the time of community schools. We're working with Green Mountain Farm to School. I mentioned Abenaki, Milhegan Abenaki's. Puppets in Education recently came to do a one-day workshop with the students at Berg Elementary who have had an increase in students who have autism or autism spectrum disorder. And so we wanted to increase awareness and also build an opportunity for community members and parents to come and learn together with students. So I think that met a direct need that had emerged over the last 2 years. So the flexibility in that funding has been really helpful because we could say, what are the specific things in your school community that you'd like support with? We've also partnered with Up for Learning at our North Country Career Center to build in student voice and participation in their strategic planning process. And then I mentioned that we're working with our capstone, NECA, Northeast Kingdom Community Action, Rural Community Transportation. And then today, when I left the kitchen at the Family Resource Center, the UVM FNEP Food and Nutrition Program was there meeting with 2 different cohorts of our Life Skills High School students. So every Wednesday for the last few weeks, and again for another few weeks in the future, Katie Black comes from FNEP to do cooking classes for students who are at the life skills level of learning. And so she comes in with visual menus and instructions for how to create meals with kids. We're getting great feedback from parents about students coming home and immediately remaking the dishes that they've practiced in the class. And we were also able to purchase safety knives, cutting boards that are appropriate for use with multiple developmental and other needs, thermometers for meat, thermometers for refrigerators, so things that really connect to safety, and also, measuring cups, measuring spoons. So those are things that students will take home. That was directly out of a conversation that was ongoing last year around students getting to the point of graduation and really not having those skills, and parents being very concerned that children would be graduating and gaining more independence, but not having safety in the kitchen or the ability to prepare meals at home. So I appreciate the flexibility of the 5 pillars of community schools. I think an expanded conversation about that would prove that many of them are interconnected. And so you can see the ways that creating fun and safe environments for families and community members to come into relationship with school providers really helps them then to have conversations about where those challenges might be that we actually can help resolve. And without the opportunity through events to create and build those relationships, we wouldn't know those stories. So I think the value of having those more fun events, those opportunities to have kind of at a glance relationship building opportunities have really aided our ability to meet basic needs as well.
Sounds like you're getting some bang for your buck up there.
Absolutely.
And speaking of that, as I recollect, our grant program was a 3-year grant program. And how do you plan for the future?
I was going to say, we just recently held some community forums actually across our sites. We had 5 different forums, and in part because of staffing concerns and trying to get input from community members about what we should do. It's interesting how the tie of the immediate need of not being able to fill positions. We had 132 open positions at the beginning of this school year. We still have about 59 that are unfilled across our supervisory union. And the convergence of those 2 ideas of community schools and our staffing has really come together. The community sees our schools as community schools. One of the ideas that came out in all 5 of the forums, independent of each other, was we need to have daycare in schools. And we should expand the use of our schools to include a 0 to 3 room as well as a 3 and 4 year old room. Another idea is we should expand our continuum of supports for students who struggle with mental health issues to include an alternative education placement within our supervisory union. And what does that look like? So I see the community forums, which really came about out of a necessity in terms of not being able to fill positions, and getting the voice of the community really reinforces that community schools is the right direction in which to go. We just will need support and more partnerships in order to pull that off. I'll be consumed by some of those ideas for the remainder of my career until I retire, I think. They're good ideas, but they'll take a lot of behind the scenes work in order to get them up and off the ground.
And I would add that since the start of year 2, we've been looking at what has worked and what has not worked, where it seems reasonable to refine and try again. We've done that, but we also know that there are some things that have been more effective than others, and that where we have leaned into partnership with other community programs that are also taxed, say with staffing, those things are not ones that will be continuing in the short term. And so I think there's some room opening up in how we look at how we pilot that last year, so that we can pivot towards some of these things that our community has come forward to say are important to them. And we also know that some of the things that we will want to continue are some of the best bang for the buck. I do not plan to continue the grocery delivery program through the supervisory union. I don't think that is an appropriate placement for grocery delivery, but it was an excellent place to pilot something that could be expanded to serve more than just the student community and their families. I would like to see that be housed within our capstone agency or another community-based program. The traveling playgroups that we run, on the other hand, are extremely low cost, and they are extremely effective in getting to know families prior to their kids enrolling in preschool. And the earlier we build those relationships, the better off students and schools are. So there are directions that we will continue in, and others where we'll have some room to think more about the priorities that our community has brought to us.
Great. Jason, how about you? How are you planning for the eventual winding down of this funding?
Right. So we understand that it's a 3-year grant. We're in year 2. And I'm seeing that, like, we have those 5 pillars, as you know, and the work that's gone into them, specifically around expansion of work and community-based learning, flexibility, and community partners. I hope that the new funding formula as it comes will help me absorb Danny Smith, or the community school coordinator, in my local budget. It may mean that I have to realign some priorities to keep that. What I've learned is having her here has really expanded our ability to focus on these, 5 pillars and the different projects that happen. And I'm hoping that some of those community partnerships will, suss out some more support too. I am concerned about the end of the funding because we've seen such success so far. And I remember talking earlier, I just hinted about our declining student population, how that stemmed. And so what I'm seeing with this expansion in flexible learning, for the first time, I've had students coming specifically to Hazen to experience that flexibility in community placement. And so I lost no students this year, effectively, on paper, because I had some go and I had some come. And it looks like that's going to be the trend for the next few years. So I'm hoping that between the maintaining or growing of my student population, the change in the funding formula that's incoming, and rearranging the priorities of my staffing, as the school becomes a little less traditional, how all those resources can shift will allow me to keep Danny, or keep a community school coordinator, and the telehealth, and expand those community partnerships within the building.
A really specific question, follow up there, but the students that you're attracting, where are they coming from? Like, what's the alternative of where they would have gone?
I suspect that they would have gone to our local high school completion or nowhere, is what I suspect, because I'm having students stay with me instead of going to high school completion, because we're able to give them some flexibility outside of a trip. Now, I mean, that's perhaps 20 students at this point, but for a school of 300, that's a lot, right? And for that's a significant drop in funding if those students were to go away and go somewhere else. And then I had 5 students join us this year from they had been in other Northeast Kingdom schools and didn't find success there. So they came to us to experience some flexibility and work with our Flexible Pathways folks.
Thanks.
Yes.
Just curious on how the grant process actually was. How was the application process? And do you all have grant coordinators who actually manage these grants, or how are they managed?
Sam can speak to how the grant came to be. We do have one person who manages sort of the paperwork pieces of the ESSER funding and does some of the community schools. That's an area that we should expand in an SUR size. The Design for Learning coordinator shouldn't also be coordinating the grant, and Sam's time should be used doing something other than grants management. So that's an area of growth for us, but it always comes down to what our priorities are and what we can fund. So.
Yes, there is a constant balance of meeting human needs and keeping these programs up and running and the partnerships robust and making sure there is enrollment in the mobile arts class that's happening tonight. And right up through the moment that I stepped into this building, I was working on probably 5 of those things at once. When we first applied for the funding, our very aspirational former superintendent, John Castle, was extremely supportive of the process. I have a very strong coworker. We sat down and buckled down on the grant for 2 full weeks to complete it in time. It was a summer grant application. I think if we had had the opportunity to do more collaboration with our school administrators and folks like our high school flexible pathways coordinator, it might have looked differently than it did because those folks were on summer break. We have had an incredible amount of support from Jess DeCarolis at the AOE. The term high touch was used in the Senate Ed Committee last week. I don't think that our grant reports would be as complete. I don't think we would feel as successful as we do in our work without her cheerleading and supporting us in that process. And I would highly recommend if this happens again, that continue in whatever degree it can within the agency. I also wonder about mentorship. I mean, already in the back of my head, I'm saying, are you volunteering for something else? But I would want to support other schools because I think every school in our SU already was a community school, and we've talked with our leadership team of administrators about how their schools can also fill out the pillars on their own, and there's a matrix in one of the supporting documents that I provided to you today about how we did that. But I think if I'd had more time to sit with a Jess or, Jason now to talk about what are the things that already are existing that fit here and how could those be supported by community schools, things might look a little bit different in this process. A grants manager would always be welcome.
Would always.
Right. So in OSSU and at Hazen, the grant was a summer grant, as I've said, and it was a pretty quick turnaround between when we heard about it, when we needed to apply. So working with my work-based learning coordinator, Jen, at the time, she and I wrote it with a community partner, and it came through. And we do have a grants manager at OSSU that helps us write our amendments and ensures that all the checks and balances are met as the things go up the chain and come back down so we can spend it. But other than that, it's me, our community school coordinator, Danny, and Jess DeCarolis that do it. And I want to echo, I have never experienced a program like this one with anybody like Jess DeCarolis. She has been so supportive and specific in helping me. I mean, we run into problems like, here's a really stupid one. We're a community school. We want community organizations to use our building, but our insurance doesn't allow that. And so they need to provide their own insurance, but the knitting circle doesn't have insurance. And so how do we make that work? Okay, so something that small was, here's a statement of our values and what we intend, and then here's what VSBIT says. And so Jess has been absolutely phenomenal in helping us solve problems and collaborate and keep us accountable for what we're supposed to do. So we don't have a grants manager that writes grants for us, but we have one that really has helped us ensure that all the paperwork gets done correctly, but otherwise it's on us.
A limited amount of time left. I just wanted to ask Deputy Secretary Boucher if you had anything you wanted to add to the conversation.
Well, I have a whole presentation, but it might not make sense to do that now. But I just first wanted to thank and congratulate Elaine and Sam and Jason for their excellent leadership. I think this is a great success story in terms of the legislature and the administration and the field working together. Jess couldn't be here today, but I'll be sure to give her those thoughts rest. I did send a little late a full summary of the awards while they were presenting. And also a lot of what I had in the presentation, the 5 pillars, the requirement to have a community schools coordinator. So every entity that received a grant has a SAM or a DAN, and that was a requirement. I will say it's pretty amazing, and it's great to personally see the success, because some of the folks who were here may recall that personally, I was a little hesitant about this, because I knew that doing a grant in the summer would be really tough on the districts. And so I'm just really pleased. And I think we were wonderfully surprised that the applications came in. I would credit Jess with the deep understanding of what it takes to successfully lift a community school model. And that was very critical for her, that the supports are there for this grant in particular. So you have to have those partnerships, as you all know, and those community collaborative endeavors. And sometimes those are the hardest to actually get up and running without some supports, someone to actually do something else that you have to do so that you can actually, that you usually have to do so that you can actually focus on those collaborative endeavors. I think that's about all I would say.
Great. We may need to come back and revisit this as well. But committee members, Sri, did you have a question?
Yep. So Sam,
Question?
but yeah, I know. I'm getting there in 1 second. I have to frame it. I have to provide a context. So I just want to say the mentoring that you're talking about, I would really support you pursuing that. And I'm wondering what it would take to be able to expand these programs and offer your skills and knowledge to help people either initiate or expand their programs, because I feel like you are awesome. I mean, what you've done, and I'm so grateful. So.
Well, I am constantly volunteering for things or having big ideas that require more of my time. I think having a cohort model where new schools, I don't know how this might be rolled out, but if it's not everybody all at once, could we have regional cohorts that meet together? I think we are all excited to be back in person in some of those ways, and being able to leave our buildings to focus on that work would really help a mentoring experience to be focused and solutions focused, I think, as well.
Yes.
Can I just add one more thing that I thought when we were talking about sort of the funding cliff? So there are direct federal dollars that actually LEAs can apply for community schools, and so we'll be looking at that. That's a standing program that got an infusion of regular federal dollars as a result of COVID, and so Jess will be following up with you on that if she hasn't already. We can't apply to those as the SEA, but we want to support LEAs, particularly those of you who've already had some success. You're very likely then to be, to get those grants directly from the federal level. Of course, there are always strings in federal grants. The other thing that we'll be doing is, and this one's a little tricky because we have a supplement, not supplant provision, as you all know, but there can be ways to actually, in terms of reprioritizing or grading and blending existing or new funds. There are ways, all of these things that fit within community schools can be covered by title funds. And so that's another avenue to think about.
We appropriated $10 million for this. Did that get expended, or will it be expended by the end of the 3 years?
I think you appropriated $3 million.
3.4.
It was 3 million per year.
Yeah.
Got it.
Yeah.
Okay.
Yeah.
And will there be any leftover money that could extend the program any longer?
It won't be significant enough.
Okay.
I mean, it would then be in a position of, we have to cover pick.
Yeah.
So I think the field and the team have done a great job of maximizing those dollars. It didn't add up to exactly
Right.
$1 million, but it's pretty darn close.
A couple more minutes here if anybody had a further question. Yes, we're going
I was
to.
just say, I think more probably a comment for the committee, but I would like us to come back to sort of understanding that federal funding stream, how much that is, how accessible that might be to districts, or is this something for us to consider in terms of another grant program, or, is it something that should be more of a automatic amount of funding to districts, or how to build on the success and not just sort of marvel at it and say thank you and then not follow up.
Yeah, I would say it would be really detrimental for our systems now that we have this level of support built and we're sort of up and running to then say, whoops, no more funding. That would be the wrong move from our standpoint.
Well, and I guess if we're going to invest more state dollars in this, given what we've heard about federal dollars being available, is our money better spent building capacity at the AOE? So there's another Jessica Carolus out there who can help LEAs apply for the federal dollars and navigate that. It's something to think about. Any other questions? Oh, go ahead. I'm sorry, Representative Bush.
Did you have a pre-K? You have a pre-K?
We have pre-Ks in each of our elementary schools.
Okay, and it was just talking about adding 0 to 3.
Yes. Yeah.
Is that feasible to move ahead with?
Somewhat. It's intriguing. We'll see. Some of our schools don't have room, so then it would require building or partnering with someone else. And so we'll see. But partnering that with, do you make that a sort of a job benefit for employees? And then that helps to attract people to your SU. It's an intriguing idea. So as I say, it may take the remainder of my career to flesh some of this out. We'll see.
That's one more quick question.
Please.
Who owns your vans?
We do, the North Country Supervisory Union, the Bernie buses.
And how do you, Bernie buses, that is great. And then in your insurance policy, who's allowed to drive them? Is it just administrators or?
Whomever's
volunteers?
identified. So
Okay.
whoever's the driver, we have a policy around that and we provide the information. We have a transportation coordinator at the SU level. We also have 11 other vans that we use for transporting students who have special needs to alternative educational placements across the region. So it's a complex, the complexity is something to marvel at.
Yeah. Good job.
Oh, I just had a quick comment.
Yes.
I just wanted to congratulate you all on your Encore after school and summer program up in the North Country. So I've worked with a few different after schools across the state of Vermont, and I feel like Encore is really a standout. So thank you for your work there.
Beth Chambers is a really remarkable person, and she is being recognized. She's in Washington, D.C. right now as our Vermont representative for that work.
Oh, wow, great. Yeah, she's fantastic.
She was one of my middle school students many years ago.
That's great.
Well, thank you very much, especially for making the trip all the way down here.
Yeah.
Jason, thanks for tuning in. Appreciate your view from Hazen.
Thanks for having us.
Thank you.
Thanks.
Thank you.
Here. Everybody okay to go 2 to 3 here? Okay, yep, let's go for it. Hi, Cheryl.
Hi.
All right, so committee, we're going to shift gears here again. I've invited Cheryl Huntley, who's the Program Director for Youth and Family Services at the Counseling Service of Addison County, to join us to talk a little bit more about youth mental health, the role of the designated agencies within school districts. Part of the reason was because I'm from the area. We had a legislative meeting before the legislative session where this was definitely a topic that came up. I've asked Cheryl to speak on some of these topics, and then we'll open it up to questions for folks to learn a little bit more. Are you all set to make a presentation to us before we go into questions?
I am. And
Terrific.
thank you for having me.
Joining us, go right ahead.
Okay. I'm Cheryl Huntley again. I'm the Youth and Family Director at the Counseling Service of Addison County. And I truly appreciate the focus of this committee on mental health in schools. Schools are just such a foundation for kids and families. And in practice, they've ended up being places that families look to for support and help, as well as a place for their kids to learn. And it's a big task, and it really needs to be shared. mental health really wants to be seen as a resource and a partner to schools. And really, we want socially, emotionally healthy kids in Vermont. And we really see ourselves as a partner with schools in that work. I'm understanding you have heard quite a bit of testimony already about sort of the needs that are presenting in schools, what students and teachers are seeing. You've heard some about the funding. What I'm understanding is it may be helpful if I could offer some ideas about maybe a roadmap through this. And I have thought some about what it's kind of a framework to think about the issues in. It's a complex topic. I don't think there's any one easy answer. I think it probably in many ways will need to be individualized to schools. But there's a framework with some shared language I thought might be helpful today. And if that seems okay, what I'd like to really talk about is I'm thinking about workforce, systems, environment, and families as sort of a framework to share some of my thoughts.
That would be terrific. Thank you.
Okay, I'll jump in then about workforce and maybe pause a bit after each sort of section. And if there's questions, I do my best.
Great.
Okay. There's no doubt that workforce needs to be a focus of attention. I'll add to the testimony you've already had that hiring has been extremely challenging. Funding for salaries has been critical to just maintaining our workforce. We know that some of the impact from last year's salary increase did allow staff to stay who had already made plans to leave due to the salary differentials. But the reality is we actually have not had an applicant, a master's level clinician applicant since last spring. Not even an applicant. So it's really a struggle to just meet the workforce demands. And that means we do have vacancies in our school-based clinician positions. And it's been pretty clear to us that our schools would love to contract with us more, specifically for some of the behavior intervention supports, and would happily do so if we had the staffing to offer. So it's definitely been a struggle. We've been really trying to work on building our internship program as a way to hopefully create a path to employment here. And that offers me certainly some sense of hope. But anything that can incentivize college students, graduate students to stay in Vermont and work in the DA system, I think is kind of a winning approach at this point. We're also really working hard to retain the staff that we do have, and really been working on supportive supervision practices. And we've really seen success with that approach. And I want to talk about that a little later, because I do wonder if it's an avenue of that supportive staff has really helped with retention and may help with teachers and the school faculty as well. These are stressful positions these days. It's really hard work. We're still sort of reeling from pandemic impact. And I think people need maybe a different way of being supported than we have historically had. The other thing I wanted to mention around workforce is that, when you're a children's program, that means all of the kids that you serve go to school. And so the impact for services is not just from mental health clinicians in school buildings, but also from the staff that we have that work out of our office. So our office-based and outreach clinical positions, the vacancies there also impact what we're able to offer to kids and families. And, just at an example of that is we have had 2.5 FTEs worth of vacancies in our office-based staff since the fall. And one office-based clinician, I think of as being able to serve usually at least around 30 kids on a caseload at any one time. So to have 2.5 positions vacant is probably about 75 kids that we're not able to serve per month. And that's a lot. And, that's CSAC, who's a relatively small agency. So the service impact is not just on clinicians within the built school buildings, but also for the people working out of our staff and serving kids that way. It's, I understand the frustration schools have had with the vacancies and and why many places have felt almost wondering whether they have to build parallel systems, and yet I think not really wanting to. And I would have to say I really agree with that. mental health services need to really be a part of a continuum of care. We need to be able to offer, an effective service delivery system for kids. Includes crisis services, home-based services, family services, substance use expertise, and really that supervisory support. And, I think one of the things that we have certainly seen through the pandemic, or the positive side effect, may be some reduction in the stigma associated with mental health and a recognition of the value of that. My guess is that we should not anticipate a reduction in demand for services. I think the need is likely to maintain. And that means if we're going to be able to serve kids and families effectively as a DA system, we are going to need Medicaid rate increases and increased capacity funding to meet those needs. So those are my additional thoughts on workforce. Is there anything I can pause now if anyone has questions or thoughts?
Questions or thoughts, or do you want to hear more before we ask questions? Why don't you keep going, and I'm sure more questions will creep up as we go.
Okay, sounds good. My next part of my framework is systems, and systems make a difference. And by systems, I mean really how we work together. That matters. And how we understand each other's roles, our skill sets, referral pathways, best use of funding services, best matches for services, all of those things. If our systems are strong together and we understand that, I think our resources sort of increase despite our limited workforce capacity. We have better ways, more efficient, more effective ways of working together. So I think systems really matter. And they're often reflective of relationships and history. And there's been so much turnover in the last few years in both the DA systems and within school systems that I feel strongly that the relationships need to sort of be rebuilt and re-explored. We know each other through Zoom sometimes, and not very well. And having those relationships, I think, allows us to more effectively do what we do. It allows us to problem solve together more effectively, understand limitations in systems. It's sort of like that idea of, to speed up, we need to slow down. And slowing down right now may mean really pausing to build some of those relationships so that we can work as schools and DA systems more effectively together. We've begun a series of conversations like that with one of our districts, and I really have high hopes for it. It felt like a really successful meeting. I think we're seeing that the numbers of ways that we overlap, and we really want to understand how to do that as well as we possibly can together. We don't want to duplicate efforts. The on the ground corollary to all of this is sort of, what meetings do we all attend? Who goes to which meeting at a school? Are DA clinicians included in the, for example, MTSS, multi-tiered systems of supports? Are DA clinicians routinely involved and included in those team meetings? Are they at the committees that assign staff to meet with students? How are they communicating? We're finding that systems need to be able to be very nimble, to be responsive to student need. And it's easier if we're all at meetings together and understand how to do that. Schools, there's many people that care and help kids about kids and help kids in school systems. There's guidance staff, school nurses, ESSER funded positions, social emotional learning coordinators, school employed social workers, administrators. I've repeatedly found that not everyone is in sort of the right communication loop with some of those other positions. They may not know each other well enough, not aware that maybe the school nurse is seeing that child every day. And so teaming together, those system impact, I think, is big. And then there are resources outside of school buildings, and I'm thinking particularly children with needs for high levels of intervention. Do we have a shared understanding of when and how to use coordinated services plan meetings and gain access to other higher level of care if needed? So those are kind of some of my thoughts about teaming and systems. Those are, I think, real pathways to improving and working more effectively with the resources that we do have. Environment was my other.
I'm going to stop because we have a question from Representative Austin.
I'm just wondering if parents need to sign a release, you know, for you to be, for the DA person to be in a meeting. If you were talking about a lot of kids, would parents need to kind of sign a general release that, you know, they would know that outside agencies were involved in, you know, consultation or meetings with teachers?
It's a good question. And I think that someone may depend on individual schools' policy. I think some of our districts, for example, have, you know, part of handbooks in schools say that the mental health center participates in the educational support teams, for example, at a school. You know, routine practice for, I think, most DAs is to ask for a release to talk to schools, because we understand the incredible importance of being to collaborate with school districts around all of the kids we serve. So, you know, it's pretty routine for us. We get them, and parents really, I think, understand that and are good about it. We have really relatively few parents that have ever refused a release to coordinate care with schools.
Great, thank you.
Yeah, it's a good question. Any others?
Yes, Representative Brown has a question.
Oh, thank you. So you talked a few minutes ago about how sort of that shared history and relationship building is the thing that's sort of lacking with staff turnover. So I guess what are the best, most effective spaces for that to happen currently? You know, you talked about how sometimes regional meetings are bringing folks together, but if you had to sort of say where that's most effectively taking place, do you have a sense of that?
I do think it's within the school building, and you know, those are those day-to-day interactions that have to happen. So that's important, I think, between the mental health clinicians within a building and the staff within the school building. But there is that other layer of, to really make systems effective, I think administrators need to know each other. So I need to outreach to school principals. I need to outreach to school special ed directors, superintendents. We need to be able to work together and understand each other's challenges, though, at that larger systems level as well, so that we can support staff, create allowances for people to attend meetings, to create the systems that allow that communication. And again, that, you know, happens well in some places, and if you don't know someone, it's harder to make it happen. You have to work it a little bit harder. Be intentional about it, I guess, is my thinking.
Maybe you could just talk a little bit. I think you're kind of on an interesting point here about sort of rebuilding these relationships. And I think, not to promote my own area, but Addison County has been well known for good collaboration, really, among all social service agencies, including the public entities like schools. And talk a little about how that's fallen apart through turnover and COVID.
Well, I hope it hasn't fallen apart entirely, but we've worked hard at it. And, you know, but you realize we've got, you know, new principals, new staff, and we have to sit down again and say, tell me about yourself. What do you do? How do you understand this work? What works for you? What are you finding you may not understand about a system? A new administrator coming in from another state is, you know, Vermont's a bit of a mystery to unravel and when you first get here. So it's, and I think it's creating those opportunities to talk and really reaching out, taking the time. We're all incredibly busy. I think the relationships in Addison County held us in really good stead during the pandemic, and I hope they're still there. But, you know, whenever there's inadequate resources for demand, it can easily turn into some tension somewhere between a system. And if we know each other and can proactively problem solve that, it helps. It helps. It makes a difference. And it's just that day to day. I was trying to do that this morning. I spent this morning trying to talk with principals and the special ed director, trying to pave the way for a student with a difficult situation. And I think it worked out, and it took time this morning, but I hope that for that student, that's going to be a better outcome because of that.
Other questions on systems here, folks? Otherwise, we'll move on to, you said environment is our next.
Yeah.
Very great.
Environment was my next thought. And that's, the school building, the community that we're all working in. Supporting students means recognizing the impact of kids in the environment that they're within. And that means sort of understanding that a child's experience at home impacts what happens at school, what happens in a classroom impacts what happens on the playground impacts what happens with peers. It's all interconnected and it's interactional. It's the understanding of, food and shelter and all of those sort of larger environmental impacts on students and what that means about their mental health. And understanding how that may be precursors to a difficult day with behavior, for example. We have to understand how those systems work and how to access resources for those larger environmental concerns. Those predictors of health are really important. But then you also narrow that down a little bit to teachers, and are key in the success of students. And they are also juggling enormous demands during a school day. I stand in awe of the work that they do every day. And when we're seeing the need in mental health, I have to wonder whether we need to support and offer different types of training to teachers to support them to do that work. A chance for teachers to sort of pause and reflect and be able to sort of look at, how did I handle that classroom that day? How did I handle that behavior, that student? Is there another way I can do that? What worked well, what didn't? One of the differences that's just a kind of a culture difference between mental health and schools is the emphasis in mental health on supervision as a practice to support staff. And it's the culture of mental health would say that supervision we certainly as an employer hold a responsibility for supervision as an employer, but supervision in mental health is often a place for staff to come in and take the time to sort of sit back, think about their work, reflect on what it has meant to them, what maybe of their own issues have come up because of some of the needs of a child, for example. It's a place to sort of step back in a safe, learning, supportive environment. And it's really valued within the mental health system. Supervision people want their supervision time. Schools are a little bit more hierarchical in nature. And I wonder if this is a place where mental health can actually contribute, share a piece of our culture with schools and could we help offer a place, I don't know, once a month for teachers to get together and have that chance to look at their own practices? Would that actually, again, help reduce burnout with teachers, help retain teachers, and have more effective outcomes for children and the behaviors and the mental health needs we're seeing in classrooms? It's a different kind of work that we're asking of teachers now. And I think if we're going to ask teachers to sort of recognize children's needs for mental health intervention, for behavior, we also need to offer the teachers the support for that. And that may be just a way mental health can contribute something of what we know to another system. It's sort of, again, that slowing down to speed up thing. I think it might help in the long run. I also think about strategies like flexible staffing and consultation as something to offer teachers. Schools that have flexible staffing capacity to, if kids in that room are having a really bad day, a teacher to have another adult to come in and help out for a little, to give the teacher a break. That kind of thing can be invaluable for teachers so that they can take a breath and go on. And consultation, we've been doing some of that in a couple of our schools, and I would say it's been a very appreciated and effective way to intervene. So it's not necessarily a Medicaid billable service. So it is schools making the choice to contract with us for that additional consultation time. They've been primarily consulting with us with our board certified behavior analysts who can really offer ideas outside, a different way of looking at a child's behavior, and offer some behavior planning. And that has been a really effective strategy to help teachers. And that is a strategy that may potentially needs a different kind of funding for between schools and mental health. I was going to move on to families, but I can answer questions on that.
Could you just talk a little bit of, about, because you just mentioned it, Medicaid billable services,
Yep.
and really sort of where a designated agency has to draw the line in what they do, because what they do is generally funded through Medicaid billing within, yeah.
Well, the wonderful thing is that the Medicaid funding stream that I think Laurel Omlin described to you for school-based clinicians is considered a case rate. And there's flexibility within a case rate that's different than within fee-for-service billing. And it's a really valuable model of funding. What you have to do for us to earn the money that we need to cover the cost of our employee is we have to meet the core billable hours required by the case rate. So we have to have 2 hours of service per child per month to be able to earn the Medicaid for that child. So what we budget for is, it changes between PBIS schools and non-PBIS schools, but roughly we need 10 to 12 kids on a caseload where we're seeing them 2 hours a month each. So the good part about it is the math looks cleaner than what it is on the ground, but 2 times 12 that's 24 hours of direct mental health consult work that needs to happen between a clinician and students per month. So there's a lot of hours left in the work week in a month. And that time is flexible to be able to support teachers, to go to school team meetings, to work with kids in more psychoeducation roles, to work in, to include non-Medicaid eligible kids in, for example, groups is often a format that we may try to do that in. So there is a broader capacity to support teachers and kids. It's usually what is happening is we're not doing a minimum of 2 hours per kid per month. Most of the kids we're serving require many more hours than 2 hours per month. So the math isn't quite that clean, but you can see that there's generally still some flexibility to do that kind of work.
Are you saying that if a clinician carries that caseload, they'll get enough Medicaid funding to support their position?
Yes.
And theoretically, they've got some added time in there where they can serve non-Medicaid needs.
Yes, and support teachers and support classrooms in a more flexible way. Particularly, we have wanted to use it to help improve school climate and be on sort of a voice for a mental health perspective on like school committees. We think that's been a useful use of that time. But again, most kids take more than 2 hours per month, or you've got one child who really requires a high level of intervention. And we've got clinicians that see those kids for multiple hours every single day. So depending on the needs of the caseload and the kids, you're juggling, you've got more or less time. And right now, most of our clinicians are having higher caseloads than the 10 or 12 kids that are required by the minimum of the funding formula, just because of the demands in schools and the needs. And that varies from school to school and the needs, the acuity of the child. Generally speaking, we are seeing much more acuity in the needs of kids than we did pre-pandemic.
Great. So yeah, let's move on to your next topic. Thank you.
Okay, thanks. The last part was families, and you know, they shouldn't be last. They probably should be first. They are a key component of how we all need to include them and have their voice at the table and have them help to understand the needs of their children. And families are stressed, and I'm sure you've heard and understand that. It's parents are worried about their kids. The counseling service had more requests for services in FY22 than we have ever had. The need has been enormous, and families are so struggling, and just the stories are, you know, they're very poignant to hear that parents worry about their kids. And for many children, family treatment is a critical component of improved outcomes. And it's also a more time-consuming way of intervening. It doesn't work well in schools, so that's usually often where we're bringing in the other services in our array of children's mental health services. It can be time-consuming. It can be slow-moving. You're trying to help parents understand what their child may need. That child may need a different way of parenting. And so parents may need to learn new skills. And this is in the context of really stressed family situations, often with complex trauma as a backdrop to that. Our wait lists for family services are much longer than I would like. And to me, it speaks to the need to really look at funding for our core service delivery within mental health so that we do have the capacity to do that family work. It's a really key component, I think, for kids. Parent mental health is often one of the best predictors of a child's mental health. And for that reason, we often also need to look at the paying attention to the mental health needs of our adult system and the funding for adult systems. Our parents are often needing to be in treatment or substance use treatment or mental health treatment within our adult system of care. And again, there can be wait for services there. I do think there's an exciting kind of new opportunity that's opened up within the pandemic about another way to involve families. And, you know, that is Zoom. Pre-pandemic, I don't think it would have occurred to me to think about offering parent workshops or parent support on Zoom. And Zoom has been an effective way to reach parents when they're working or to engage with them. But I think it's also potentially a tool for sort of broader school engagement and psychoeducation opportunities. Can we teach parents, for example, about sort of anxiety reduction strategies in kids? Anxiety is one of the most common things we're having for referrals right now. That's what parents are calling most worried about. And that is often helped by doing some skill teaching. Schools, you know, have that unique piece of being kind of seen as a community hub, and offering psychoeducation to parents through a school. I can't help but wonder if that might be less stigmatizing than going to a mental health center and allow us to reach parents in a different way and build community and supports between parents. So those were my my four sort of ways of trying to think about a roadmap through this. It's working with schools is in partnership with them has always been very rewarding and hopeful to me. I have great respect for the pressures that schools are under, and day to day, and part of experiencing the pressures the DA system is under. We have worked hard in Addison County to build a collaborative structure between schools and mental health, and I think it really does pay off. I think it does make a difference. Partnerships work. You have a key role as legislators in creating the funding that allows us to fill in some of these gaps. And so I appreciate the attention you're taking to mental health in schools. It's a core piece of the work we need to do to raise healthy kids in Vermont. So that's what I don't know, hope that framework is helpful and trying to think through some of the issues that we're all facing right now.
I think you may have answered my main question, which is, our role can only be so much as legislators. And obviously the main tool we have is allocation of money. And what I'm hearing from you is that mental health services need more money. And you said, especially in your core services, which extends beyond kids, but is really about families. Would that be an accurate thing to say?
Yes, it really is. It's true. I mean, the demand is so high right now and the acuity is high. We're a stretched system.
Representative Buss has a question.
Hi there. Laurel shared some information from the Vermont Care Partners, and it is adult, youth, and teen mental health first aid. Do you utilize that at all, or have you seen its effectiveness?
That's interesting. I am very aware that many of the DAs have used mental health first aid and find it to be a very effective way to go about it. Addison County has had a bit of a bias around it, and we have tried to, I have some concerns that it's not a strength-based enough tool. It is an evidence-based practice, and I support people that want to do it. We have worked in Addison County more on focusing on resiliency, and have worked in the last few years on our OK, You've Got This campaign, which is a more of a strength-based resiliency focused approach to teaching parents the 7 C's of building resilience in kids. And that has been our sort of population health approach to building resiliency. And it's, I don't know if you can see my water bottle from here, but that's our logo, that's our sticker. Many kids in Addison County have those stickers on their bike helmets. So we handed them out at all the elementary schools, and kids in Addison County that got vaccines got both stickers when they got their vaccine. So it's been a fun way to teach resiliency skills.
Representative Williams has a question.
Yes, thank you. Please forgive me if you have answered this, but I'm going to ask it to get it clear in my head. There are many mental health agencies within the state, different avenues. Is there a chance that maybe some of them are being duplicated and could be combined, or resources where there's always never enough resources? Can they be grouped together to have a stronger base to provide? Do you know what I'm asking?
My sense of the designated agency system, each of us has our own catchment area. So we have a defined geographic area that we focus on, and we are all private nonprofit entities in working under a provider agreement with contracted partnerships with the state, and all receive funding to provide mental health services within that catchment area. So I don't think we have parallel provider agreements to provide the same types of work. But I would say we're not duplicating at all because of the separate catchment areas. We're hopefully all empowered to try to be creative in meeting the needs of our own communities as best we can within our our funding that we do get. Does that answer it?
Yes, it does. Thank you.
How about just duplication, as school systems seem to be spending more resources on building their own parallel mental health services?
Well, that would definitely be a worry from my point of view. I mean, partly because you do potentially have duplication. And I worry about it at a couple levels. One is mental health systems services to me need to be offered within a continuum of care that offers particularly things like crisis care, in-home supports, supervisory supports to staff. The availability of psychiatry is often important. It's working within that whole continuum of care and with access to higher end care. Mental health centers are the agencies that can screen for hospitalization for kids who do need higher level of care. So when there's a parallel system going, families and children don't necessarily have access to that whole continuum of care. And from a workforce level, I worry about parallel systems where school systems can often pay more than what the DA system can. It's a risk also with healthcare. If healthcare increases the number of mental health clinicians within their system, then essentially you're creating a way that, staff who aren't being as paid as well for their own families and for their own life decisions may choose to leave the DA system, and that potentially harms our capacity even more.
Representative Taylor has a question.
So you spoke a second ago about kind of having your own geographical area that y'all work within. Are you able to cross those borders if needed, or are you pretty much landlocked in that geographic area? And if you can't cross the borders, I see with your answer to Rep. Williams, I can see the benefits, so things aren't duplicated, but do you think it's the most effective way to operate if you're locked into that one spot?
There's not a, the locking in there is some flexibility in there. For example, if I could think of a family where, if they're living maybe just across the border in Rutland County, but the family works in Middlebury, they have childcare in Middlebury, they're doing school choice, and the family goes to school in Middlebury, we may choose to serve them just because this is the family's center. So there's a little less rigidity, but if a child needs, for example, comprehensive care and they're in a school district outside of our catchment area, it actually could divide care more if we're crossing those catchment area boundaries. So it's a sort of an agreement between us all to stay within our catchment areas as much as we can. But there are certainly times when there have been exceptions made. But generally, we each want to be able to serve. And when we have limited capacity, you sort of try to serve the people within your own catchment area as a priority.
Thank you.
Representative Brady.
This might be too big of a question for the time we have, but where are these shortcomings and maybe the bright spots in prevention when we think of sort of healthy kids and healthy families and preventing the need for reactive services?
I love that question. It is, to truly intervene and have healthy kids in Vermont, I do think we need to back it up and look at more prevention. And right now, clearly that is not where the funding is. And we are all using limited resources and limited capacity to meet the needs of high-end families with high-end needs right now. And, I think we'll have to continue to do that until there is additional funding and or targeted funding for prevention. It's a challenge. It's a real challenge to try to do that population health work. If I had more funding and I could wave a magic wand, I would do lots more of our resiliency project, of educating around trauma-informed care, of having mental health services available in doctor's offices and childcare settings, and with easy access and the capacity to meet families where they are. I would love to have the opportunity to do that kind of work. And I really have to believe that over time that could make a difference and bend trend lines, but it's hard to do right now.
It's hard to do because so much of your resources have to be spent on reacting.
Yeah, reacting, and when children and families are in crisis, we need to take care of them. We need to support them.
Going back to your original topic, which was workforce, could you be a little more specific as to maybe some incentive ideas that you might have in terms of keeping recent graduates in the state?
Well, I know there was some, I know that loan repayment has been one piece that's been out there at times. And I know that's probably a complicated issue at the federal level right now. So I'm not sure where that goes, but it certainly did help when it was offered earlier this past year. I've been hoping that by working within the college systems, we have recently built a partnership with Northern Vermont University and had more interns from there applying for internship spots within our agency for next year. And building those pathways between Vermont colleges and the DA system, I think will potentially be a help in the long run. I don't know quite how to do this, but if there's a way to, give bonuses to students that choose to remain and work in a DA, I think that those kinds of things might be helpful, but just creating the internship pathways, I think may help to have students experience working in the DA system. And I think generally when people get here, there's a passion in this work for most of us. And I'm hoping that is contagious and they stay.
I wonder if this conversation continues, if we're going to get down to our usual core things but except that they can't find a place to live.
Yeah.
Seems to we seem to return in many conversations to those issues.
It does. We have had one of the last times we offered a job, the clinician called a month later and said, I can't find a place to live.
Yeah.
Maybe we need to put that in our school construction staff housing. Maybe not so joking.
When you talk about sort of, I think about breaking down the barriers between DAs and schools. You talk about rebuilding relationships. Is that best left to, the regional DAs and the school systems, or does that need to start at the Partners in Care and Vermont Superintendents Association level?
It's an interesting question. Yeah, I don't know the Superintendents Association work that well. I tend to think it's a bit more of a regional or local conversation, but if there's a way to incentivize that, I have wondered about our local interagency teams. Each region of the state does have a local interagency team made up of child-serving agencies and schools. That may be also a place to initiate some conversation. An example would be, our local interagency team right now, for example, has recognized that there's been a bubble in concern for young children. We've had 6 and 7-year-olds, kindergarten, first grade kids with some real behavioral problems in schools and some increases in aggressive behavior. So we are getting together the childcare providers in town, hoping to build a larger meeting. We have a planning meeting tomorrow, and we're bringing together childcare, hopefully some kindergarten teachers, some elementary principals, to think better about how can we transition kids from childcare to school. Are there skills that we need to be teaching? Is there something differently we can do to prepare teachers? How can we reduce the behavioral aggressive episodes we're seeing in young kids? I'm guessing that's a pandemic related piece that we're seeing with kids that had some they lost some skills with wearing masks and not socializing, and they missed out on some developmental tasks that we need to make up for. But that to me is an example of potential collaboration coming together around a common need. If we can identify that and bring people together through local interagency teams, through superintendents, through administrators, it may be different in each region what works, but coming together to problem solve can both build relationships and maybe make some difference at the same time. I feel excited about those kinds of opportunities. I think they help build collaboration in the long run and help us get creative.
Great. I'm going to just take a quick last survey of the committee. I think we're set here then. Cheryl, thanks so much. You devoted a lot of time and thought to this, and it was really great to hear your testimony today.
Thank you very much. I appreciate the chance to speak with you all.
Great. Have a great rest of your day. Thanks.
Thank you. Bye-bye.
Do you have a quick question here?
Yeah, I want to throw this crazy idea out there. I get frustrated when, and not that we just did that, but when we talk about solving problems with money. And I want to share a story. Someone said to me, is there money in the ARPA funds maybe to build like a sports center, maybe a gymnasium or something like that? And I looked into that, and yes, there is, and they're going to research that. But I remember in my community, we wanted to do something like that, and the community got together, and they found someone who volunteered that had equipment. They found other people willing to donate a little bit of time and a little bit of money and a lot of time. And we built a baseball field, a basketball court, and we got someone's old chicken coop to turn into a community activity, meeting center. It wasn't big, it wasn't great, but it was very inexpensive. And I wish that we could start thinking in how we can make things happen with resources other than money. That's.
Yeah, I would agree with that. I said, it's because of the level that we're at and the tools that we have available, because we're not the community.
Right, right. No,
our tool is the allocation of scarce resources.
right. At this level, and I just wish we could take my ideas and take them down to the community level and encourage our communities to think outside the box. How can we make this happen without a lot of money?
Yeah.
And I know we're here to spend money and put it in the right directions, and I'm okay with that, but help our communities think less money. That's my thought.
All right, folks, we are done for the day. Enjoy the floor. And we are the agenda has changed a little bit, so we are in at 9 tomorrow. 9. With Beth, going to walk through something.
And that.
I'm going to walk through, a bill